Patients with chronic bronchitis are by definition COPD patients that have predominantly cough and sputum production. These patients are at a higher risk of exacerbations, increased morbidity, hospitalizations, as well as mortality. Current inhaler therapy can ameliorate these symptoms of these patients only to a specific degree, so that these particular patients have a very impaired quality of life, which contributes to the disease burden. Patients with chronic bronchitis have an increased number of mucus-producing cells in their airways. If you are able to ablate them in a way and in a fashion that the airways regenerate themselves, they produce less sputum. These patients, they have less mucus-producing cells, and therefore hopefully in the future also less inflammation, better airflow to distal parts of the lung, and less symptom burden for the patients. We perform bronchial rheoplasty as part of a bronchoscopic procedure. Within the study that we've presented at ERS this year, we have done 2 bronchoscopic procedures separated by 4 weeks. First, we treated the right side. After month, we treated the left side. In prior and after the procedures, we took bronchial biopsies to ensure that the treatment that we have applied also actually can be seen in terms of reduction in airway producing cells. So we verify our treatment effect using histology. So at this year's ERS, we presented the first in-human study of rheoplasty. That said, we have included 30 patients to date. These patients underwent 2 bronchoscopic procedures separated by 4 weeks. And what we were able to demonstrate is at follow-up time points at 6 and 12 months after the procedure that patients have less mucus-producing cells. They have an increased number of airways that are now ventilated, and most importantly, they have much better quality of life and a reduction in the disease burden that is associated with chronic cough and sputum production. We select patients for the rheoplasty procedure on the basis of their specific phenotype. It's the patient with chronic bronchitis, the patient that reports chronic cough and sputum production, which impairs his or her quality of life. And if we are able to selectively find these patients, which unfortunately are frequently undiagnosed, then we're targeting the right patient.